Most often, smoking begins as a curious novelty. It is an activity enjoyed by some and can bring a feeling of community among peers. But before you realize it, it develops into a habit that's difficult to escape. People see daily cycles of nicotine dependency and yearning as being imprisoning. Perhaps the most addictive drug is cigarette use. It is marketed to draw you in and is made to turn you into an addict, even though it is a leading cause of cancer and a variety of other disorders. 2 out of every 3 smokers desire to stop, and some are courageous enough to embark on this task. Before we continue, a brief request from us. If you find value in this video, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Now, off to smoking and quitting it. Why is quitting smoking so challenging? When a person smokes, hundreds of poisons and chemicals enter the lungs and body, making tobacco use incredibly addictive. Nicotine is one of them. Within a few seconds following initial puff, it enters the brain and releases a substance called dopamine. The brain experiences dopamine as a sensation of reward and pleasure. This sensation vanishes after some time. It causes agitation and the impulse to smoke more cigarettes more frequently as a result. As the body adjusts to nicotine, this is how smoking develops into a bad habit that is difficult to overcome. For the same enjoyment, more is required. This increases a person's desire to smoke more. Hence why there are a lot of folk that feel stuck in this never-ending loop. When a smoker stops, they could experience withdrawal symptoms. They could feel restless, easily annoyed, pained by migraines, constipated, and hungrier than usual. However, these symptoms subside after a few days and are often gone after a month. A physical and emotional addiction makes quitting tough for 2 out of every 3 people. Though it may be difficult, stopping the habit is possible. There are many various approaches to assist folks in quitting as of today. How does smoking affect our bodies, and how can they heal after quitting? Many dangerous substances are included in cigarettes. The consequences of smoking can vary depending on how much and for how long a person smokes and can harm our body in many different ways. Additionally, our genetics and gender have a role in it. Beginning in the mouth, it produces stains on the gums and teeth, accelerates tooth loss, impairs smell, and makes food taste less appetizing. There is more mucus and more frequent sinus, throat, and lung infections due to smoking, which also erodes the protective layer lining the nose, sinuses, and lungs. Chronic obstructive pulmonary disease, or COPD, is a chronic lung condition that can be brought on by smoking. Breathing becomes difficult, and daily living is also impacted due to the thickness and constriction of air passages and injury to the ear sacs. Smoking immediately causes a person's heart rate and blood pressure to rise, but over time, smoking makes blood vessels narrower and thicker. This raises blood pressure or hypertension. Additionally, blood vessel damage increases the risk of blood clotting, which increases the risk of heart attacks and stroke. Given that cigarettes contain more than 100 chemicals known to cause cancer, smoking is the most frequent cause of cancer. These harmful compounds alter the DNA within the cells, causing mutations that lead to cancer. Smoking raises one's chance of developing cancer of the mouth, throat, lungs, bladder, and other organs. Smoking also weakens the immune system, which in turn results in brittle bones and dysfunctional sex. The good news is that many of these risks may be minimized when a person stops smoking, and some may even go away entirely over time. As soon as a person stops smoking, they begin to experience the advantages of quitting, which lasts for the rest of their lives. The pulse rate and blood pressure begin to return to normal within 20 minutes after the final smoke. The blood's carbon monoxide levels return to normal in a day, a month after giving up. Throughout the year, the cough and breathing become better and stay well. The ability to smell things better, and the immune system begins to recover its strength. The chance of having a heart attack begins to decrease in 1 to 3 months, and after 1 year of quitting, the risk is cut in half during the next 5 to 10 years. Along with improving your health, quitting can also help you save money and keep the people around you safe. Remember that quitting is never too late. What are the methods to stop smoking? It might be difficult to stop smoking, but it is possible. Many individuals desire to stop smoking, but it could take more than one try to do so. It's good since each attempt moves you one step closer to the objective. We have a lot of options today for assisting you to try and quit smoking. Here are some suggestions for controlling nicotine withdrawal and quitting smoking. First on the list is asking yourself, why? This question of why will help you stay motivated. Having a goal and a reason to stop will assist you. Some people wish to live a better life or maintain their health. Find a good reason to stop doing it. Some people wish to stop smoking for their children or another person they genuinely care for. Second, switch out your smoking habit for something more healthy. At times, this is extremely crucial when the desire to smoke a cigarette strikes. Learn what makes you triggered. A trigger might be a situation or activity that makes you want to smoke, such as driving, chatting to a buddy after eating, or similar activities. Make a note of your triggers and attempt to replace them with something else. Keep in mind that within a few minutes, this powerful impulse will pass. So throughout this period, keep your hands, tongue, and mind occupied. So start participating in activities that you might want to try. Play a game. Start on that hobby. Make nutritious food, or contact a friend for a conversation that could help you. Third, tell your loved ones that you're about to attempt quitting so they can be there for you and understand your struggle. Include them in your road to freedom. The fourth tip is to establish a quit date. By setting a stop date and making an attempt to keep to it, you are most likely to succeed. Use medicine to help you is the fifth and last piece of advice. Your odds of success are increased by 3 or 4 times using this strategy. One such medicine that aids in managing nicotine withdrawal symptoms, improve your mood, and reduce cravings is Chantrix. Nicotine replacement therapy is another alternative. When you feel the need to smoke, nicotine gum, sprays, or lozenges can aid you. Other medications and treatments are also available. Nicotine patches deliver a little quantity of nicotine to the body to relieve withdrawal symptoms. Last but not least, remember that it can take more than one effort for you to quit smoking. So don't give up and keep trying and get help. Discuss whether medication is suitable for you with your doctor or a smoking cessation professional. You and those around you are both better off for every cigarette you don't smoke. You can get support in quitting by calling hotlines and visiting neighborhood clinics. Call them up without holding back to acquire the help you need for the success. Once you stop, turn into a champion and aid others in their quest. We all are aware that smoking is hazardous for our health, but most people don't realize how much money, time, and health it costs. Therefore, if you smoke a pack a day for the next 20 years, think about the wonderful things you might accomplish with that much time and money. Do not start smoking if you haven't, but if you already did, then it's never too late to stop. Be reminded that this video is for information, and we do not claim to provide medical advice that is tailor-suited to your needs. Be reminded to consult with a medical professional and seek personalized healthcare that will fit you. Do post some of your advice on how to quit smoking that may inspire others to quit the addiction as well. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. Anyway, see you later, and thank you for watching.